It's 8:18 now. Many women fighting breast cancer have to have surgery. Some choose to have reconstruction, and there are some great options out there patients may not know about. Noelle Gardner continues our special reports from Methodist Hospital.
Good morning. We're at Methodist Hospital and we're talking about breast cancer reconstruction for maybe you or one of your loved ones. And joining me this morning is Dr. Peter Ledoux. Thanks so much for joining us, Doctor. We're talking about breast cancer reconstruction and the options that people have these days. A lot more options for them.
In the 70s and in the 80s, Noelle, mostly people were getting reconstructed with tissue expander implant reconstruction, which in radiated patients does not work well because it gets tight and it gets uncomfortable and it doesn't look very natural. So for the last decade or two, we've been doing reconstruction using the patient's own tissue because the breast is mostly made of fat, and if we replace it with that, it looks much better. So the options nowadays are most commonly to use the lower abdominal tissue, like in a tummy tuck, and take that tissue with its blood supply, transfer it up to the chest, and you can make a breast that is soft and warm and natural.
And Doctor, you're saying that this is more natural, especially if you're at the beach or the pool, right?
Right.
Talk about that.
Much easier to hide the scars, to make the reconstructed breast match the opposite side, and so the patients just put on their swimsuit and go.
Okay, and during the cancer treatments, radiation is pretty harsh on the body. Can you talk about that?
Well, some of the patients opt to get lumpectomy and radiation, but over time the radiation will shrink some of the breast tissue and the fat tissue, and so the patients will have significant asymmetry. We see a lot of patients like that who've been out 2 or 3 years, and then there's many options to reconstruct that, but sometimes we'll take the remaining breast tissue and then use their own soft tissue to make a breast that's like the other side.
You can go to the website at PRMA-enhance.com, or they can give you a call. At what number?
At 692-1181.
All right. Thanks so much, Doctor, for the great information. And we'll be right back.